Hello, everyone. I'm Gausia Dara, PGY5 in General Internal Medicine at the University of Toronto. Thank you for the invitation to present the abstract, Medical Education During the COVID-19 Pandemic, Perspectives from Internal Medicine Trainees from the University of Toronto. I would like to thank Dr. Seema Marvaha and Dr. James Rassos and acknowledge the residents who participated in the study. Describing the background of our study, as we know that the COVID-19 pandemic forced immediate changes to the delivery of medical education globally. At the University of Toronto, quick transitions were made to new models of education, including virtual teaching, replacing more traditional methods like in-person large and small group learning and bedside rounds. The aim of our study is to explore the perceived impact of COVID-19 pandemic on the training of internal medicine residents at the University of Toronto, as we do not have a clear understanding of how various changes have been perceived by them. In terms of methods, we conducted semi-structured interviews with senior internal medicine residents using a constructivist grounded theory approach. At the time of submission of this abstract, 5 residents had been interviewed and recruitment was ongoing. Describing the results of the study, the most common themes that emerged were regarding education, personal stressors, and stressors related to patient care. Although residents liked the convenience of virtual learning, they expressed concern for the loss of bedside teaching, procedural opportunities, and direct observation. Quote unquote, "It's easier to attend multiple lectures that I would have missed otherwise if I couldn't attend in person. Post-call, I'm not going to see patients with staff, which in retrospect is probably one of the most valuable learning experiences. I had to immediately compare your clinical assessment and physical exam with that of your staff." They acknowledged how stressors like personal and family safety, loneliness, lack of social supports, and loss of normal coping strategies affected their wellness and mental health. The anxiety of, if I do see my family, am I going to make them sick? You take away some of your normal coping mechanisms for stress because of lockdown, less ways to deal with it, and you're not as good at coping. I think sometimes when the medical community, we forget how much trauma it causes to us as healthcare providers or what we're going to have to carry after this. Residents were worried about the pandemic negatively impacting patient care due to limited visitations by families and reduced access to in-person care, and struggled to care for patients who were often facing illness alone. Quote unquote, "I guess the emotional toll, how hard it's been to watch patients suffer alone. I think it's just being sad on a totally different level. And you had no treatment to give to them, so you felt helpless." In conclusion, the pandemic has impacted both the personal and professional lives of internal medicine residents who've borne a large clinical and emotional burden of COVID-19 care. It's important to recognize this, document this, and learn from it. COVID-19 has also been a catalyst to make disruptive and necessary changes to medical education. Moving forward, this forced change of providing virtual care may be beneficial to residents and patients. Thank you.